Welcome and thanks for joining us for today's webinar, Maximizing the Value of Digital Initiatives with Enterprise Provider Data Management. It's brought to you by Find Technologies. I'm Lori from HIS Talk and I'll be moderating. We have 3 speakers today. Kicking it off will be Adam Charrington, who is the Director of Research at Class Research. Adam will be joined by Ryan Pretnick. Ryan is the Director of Research and Strategy also at Class Research. And Tom White will be leading the discussion. Tom is the founder and CEO of Find Technologies. Over to you, Adam.
Thank you, Lori. Sure appreciate that. Good morning, good afternoon, everyone. We're happy to be with you and appreciate this chance to share some things that the market has been telling class. We're excited to share details of what we've been hearing and some of our upcoming plans on both data management and some of the other hot topics that are coming across our plate. If we can jump to the next slide, we'll just share kind of an overview of who we are real briefly and share some insights. So as Lori said, I'm Adam Charrington. I oversee our research on patient engagement and telehealth. And my colleague Ryan Pretnick is here as well, and he oversees our data management research. So we would love to just share real briefly some of the things that you, the healthcare professionals, have been sharing with class over the past several months. Before I do that, I just want to reiterate that if you're not familiar with class, we are compared to the Consumer Reports of Healthcare Technology. We exist primarily to help providers make informed decisions. And in fact, our #1 commandment is everything we do has to benefit you, the healthcare provider, healthcare professional. And so that's why we're here. We are happy to share this insight, and we have volunteered to help out here today on our time, and we're happy to do so. So Ryan and I both are part of an army of researchers at class. Some of this data we're going to share comes from our own experience. Not only do we work with providers and vendors in healthcare, but we are always collecting insights and sharing what we learn. And so we're excited to do that and appreciate your participation. What you're looking at is some data that came across a simple CIO survey that we did a few months ago. Obviously, healthcare has shifted in a big way. You all could tell us more stories than we could tell you of what that means in your world and for all of us as patients. But it's very clear that there is more information now than there ever has been, and there's more questions about where do things need to go. And so we thought we would just share a couple insights of what we're hearing specific to the peak of the pandemic and post-pandemic, and where we intend to go with some of that research. So you're looking at some insights that came across this simple CIO survey. And obviously, telehealth has just exploded. It's very intense of the shift that was made, not just for telehealth's sake, but all of healthcare throughout the pandemic. I feel like we're preaching to the choir a little bit when we share that with you, that this is not a new headline, you all know this. But the point being, a lot of organizations are telling us they're trying to figure out what's next. There was a time that we called Telehealth 2.0, which is expanded services that were quickly put in place for the pandemic. And now we're looking at Telehealth 3.0 and what is coming down the road next. So in addition to telehealth, remote patient monitoring, interoperability continues to be at the forefront of what organizations are asking us about, and obviously all that implies with data management and just the huge uptick of what's needed there. So if you'll jump to the next slide there, Tom, here's a few things of what class is hearing. As we look at telehealth and healthcare and where things are headed next, organizations are telling us that post-pandemic, they plan to expand specialty visits. So that's going to include additional access points, additional resources for patients, all the integration that comes with that, all of the data that needs to be aggregated and analyzed and made useful. Remote patient monitoring, both in home and in remote settings, that is an area of intense focus. And as I mentioned, in-home care, this concept of hospital at home, we're starting to hear more and more examples of that. So you can see that there has been quite a shift. There's a lot of organizations telling us they're going to reevaluate both their telehealth strategy and how they deliver care. With the age of consumerism that's alive and well, as patients, we're more interested and demanding more of our healthcare systems. We want easier access. We want better access to our own data. So there's a lot of interesting things coming on the immediate horizon that we're paying close attention to. With that, I want to make sure we spend some time on what Ryan is hearing and some of the research he has planned, and ensure that we spend a few minutes on that. So Ryan, if I can send it to you, would love to hear more about what kind of things are providers asking you about, and where do you think we're going next?
Awesome, Adam. Thank you so much, and thank you to everyone for your time today. As alluded to, my name's Ryan Pretnick. I oversee a lot of our analytic focus areas at Class, and I've been in the analytics world for about 15 years, so it's my passion. Tom, if we can run to the next slide, I'd love to dig in a little bit to what we're hearing, what we're seeing. So Adam showed a slide that talked about the biggest technology challenges for organizations during a COVID period, right? We looked at telehealth, we saw remote patient monitoring, and then we saw interoperability in real-time analytics. If we think about that, that's 37% of what people are saying that they need to do better on, or they need to find a technology or solution for. If we look at real-time and analytics and interoperability, what is the underlying pin there? It's data. And that is the key here, is more and more what we're hearing from providers is that, oh man, we are surrounded by so much data. The data is still siloed. Departments are still siloed. We need real-time or accurate data to make decisions, not only on a financial or operational basis, but to help improve the quality of care. So we're seeing data come from imaging and finance teams and patients and claims and members, and it's in structured forms and unstructured forms. Point being is that data is all over the place. In a recent study that we just found, is about 20% of data, 25%, somewhere in there, is structured data. The other is unstructured data. So point being is that we have a mound of data. Whether we can create action on it or not is really going to determine how we enhance the quality of care, whether it's on the member side or on the patient side. The other chart that you're looking at that I have on the slide, it shows healthcare organizations are relying on specific technology through COVID, right? Look, bottom line, there's no surprise. Virtual care and telehealth, it's absolutely going to be forefront and center of what everything's going on, right? But then you see the acute care EMR, or the EMR in general. Why is that important? Well, guess what? It's the lifeblood of every organization. Same thing with the core claim system on the payer side. But the interesting data that we found here is that AI and analytics is so important. It's so important to everything that a payer or provider or healthcare organization does. And when we say analytics, that runs the gamut. And to start, what I mean by that is data management starts. Can we connect to the right data? Can we transform the right data? Can we get it in a workable fashion? Then can we report on it, right? Can we get action? Can we deliver the right information at the right time to the right people to make the right decisions? And then furthermore, do we have the ability as an organization to do advanced sorts of technology use, like artificial intelligence, whether it's machine learning or NLP sorts of data aspects, or robotic process automation, or what can we do advanced with that? but the core is that we have data all over the place, and data management is one of the things that really is pushing and driving analytics here. Tom, can we advance to the next slide? I wanted to share a couple thoughts here around class and our evolution. When I got the class a little under 4 years ago, it was interesting. The conversations that I was having with providers and payers were, Ryan, I need better data. I need better visual information. It's coming in Excel spreadsheets, and it's getting sent to me in pictures, and I just need to interact with that data. And that was, again, 4 years ago, roughly. Now what we're hearing, we're having more conversations over the past year or two, is that, okay, we have a lot of data. Putting an analytics tool and having multiple analytics solutions on top of different siloed pieces of data, that's helpful. But what if we create an enterprise type of data lake or data asset for our organization? How can we then distribute analytics that are correct and that have a good quality of checkmark data that providers and payers can use to make decisions? That's where we're seeing it go. We're having more and more conversations. The interesting part is we're not there yet. We're getting there, and people are interested in we're having more conversations with large organizations and provider realm, payer organizations, etc. Why? The data's coming together. Payers and providers are coming together, and they realize how important of an asset data is. So again, 3 to 4 years ago, we had one segment that circumference solutions like a Tableau or a Power BI with a Health Catalyst and information builders and a bunch of others, and a Find and a Calibra, etc. Right? We are having a lot of hits on the analytics part. It's starting to shift. As we can see, we just built out a segment that is called Healthcare Artificial Intelligence Data Science Solutions. The key here principle that we found in AI and the data science end is our data ready? Is our data formatted? Are we collecting the right information? And it was so interesting because we're seeing this trend in analytics start to move down to the, hey, we need to make sure that we have the right data and it's formatted properly to really get end results. Furthermore, as we move forward at class, we are going to be building out a new segment that is called Data and Analytics Platforms. And we're super, super excited about it. It's going to circumference the analytics part. It's going to circumference the data management part, because that's what providers are asking for. They're super excited about where we're heading. And you can see data is the core of what we're going after. Furthermore, in 12 to 18 months, we're going to build out a new segment that's called data management that is very specific. And these are all driven by the payer and provider community. This isn't Ryan or Adam or anybody at class saying this is what we're going to focus on. These are driven by conversations within the provider community. So again, we went from analytics, now we're starting to move into data management in these platform type solutions to help bolster information and serve it up to the right people. The last thing I'll share here, kind of in a parting comment, and then Tom will send it over to you, is on this slide, you'll see post-COVID market segment investment. I found this really fascinating. This data is just a few months ago we collected it. Virtual care and telehealth, right? Obviously, we knew that was coming up. Mobile and workforce, number 2. But then AI and analytics comes up again. So we can see how important the investments are going to be within these areas of focus for providers and payers as we move forward. So again, thank you for having Adam and I, and happy to answer any questions at the end. And Tom, I'll send it over to you.
Great. Thank you, Ryan, very much. It's fascinating information, and it just kind of speaks to how the market and the industry is changing. Thank you all for joining the webinar. My name is Tom White. I'm CEO and founder of Find Technologies, and I'll be talking about provider data management and the impact it has on health systems, health organizations as they move from their current state to more of a digital focused digital world within provider data. Historically, provider data really is focused in on credentialing systems. So the provider is the credentialed physician, or providers inside the organization. And what's and that's really focused on privileging and compliance and important pieces, and it's foundational for sure. But what's happened is, as healthcare has become more consumer focused, that Adam mentioned, that the need for provider data to really shift and change into more of a digital storefront, which is, where the providers work, what their expertise is, what health plans they participate in, what their schedule availability is, so what their inventory is, whether they participate in telehealth. Adam and Ryan both talked a lot about the growth of telehealth, and that the reality is that that before COVID and during COVID, telehealth providers were kept on Excel spreadsheets, were integrated into the core backbone, the IT backbone of health systems, and the idea is that provider data is rich. There's over 600 different data points on providers. It's their retail storefronts, it's their back office billing, it's what they do, it's all these different components. And then the notion that a provider is not just a person, but it's also places and services. So it's definitely obviously people, but places, locations. So it could be a diagnostic center, it could be an urgent care center. It's also services, so an MRI, could be a virtual visit, so telehealth as well. So how do you integrate all these different types of providers into your historically focused, credentialing system and in your data management system on providers? And the way that health systems have done in the past is they've integrated credentialing data into the EMR and use the EMR as somewhat of a repository for this data. But the problem is that it's really not designed to be an enabler. And the enabling technology is super important nowadays, because it enables things like provider search, provider scheduling, all these different pieces that I'm going to talk about in this presentation. There needs to be an enabling layer of technology, and that's where this provider data management layer comes in. Some challenges that our clients that we help with during COVID were some different areas, and we look at these areas as products of the health systems that our clients find. And one example is during COVID, the simple challenge of popping up these testing location facilities all over different areas. One of our clients in New York City has 18 different testing sites, and those testing sites were popped up very quickly. They moved around as well, and they needed to enable that data to be presented to their consumer population real time. And so what they did with Find and what they did with provider data management was that they actually developed deep profiles on these testing facilities, and were able to stand those up directly through a website real time for their consumers. So provider data management, which Find is one of those platforms, enables this client to actually pop up real time testing facilities for consumers. So real time win for them. Another example is in telemedicine, is enabling consumers to go to our clients' websites and search on providers, again, people, places, and services, and be able to actually find a video visit and book it real time. And so this client was able to use the Find platform to do that video visit within their search criteria. So not just people, not just locations, but also video visits. And they stood that up very quickly. And then the third piece is around the delivery of vaccinations, and confirming that providers are credentialed and have licenses to actually provide the vaccine. So with the huge volume of vaccines that our clients and health systems have been providing, they've had to look outside of their organization and bring in retired providers that are part-time for them, even ones that don't work for them, and they've had to do a light credentialing or a light view of their credentials. And so Find is an enabler of that as well, because the provider data management platform has deep clinical data along with consumer-focused data as well. And so this is another example of a product, which is the delivery of vaccines, and how that's serviceable or enabled through a provider data management platform. And so why provider data management matters from a global perspective and really in a product world is that your customers, our customers, are used to the ease and use of things like Amazon. So, to simplify Amazon, they went into warehouses, they scanned barcodes and SKU numbers, and then indexed those into a search engine, and then identified the delivery model behind it. And so, Amazon made it simple and easy for consumers to find the right product and then to get the right product in a reliable fashion. And when we look at healthcare, we think that healthcare needs to have that kind of vision into the services and the products they offer. So an MRI is a product, a doctor visit is a product, an urgent care encounter is a product, a telehealth visit is a product. And so how do you first index and understand what you have as far as products, and then serve those up from a search component? And then how do you actually do the delivery, which is the booking piece? And the reason that it's difficult is that there historically has not been any platforms in health systems to manage and integrate that view of the world. There are databases, data lakes, data warehouses that exist right now, but they're really meant from a BI perspective, back to Ryan's points, in that they're not designed to be enablers of this consumerism that's happening across the industry. And that the reality is that there's lots and lots of fields that health systems need on providers that may or may not be tracked right now. They're siloed in different areas, and to Ryan's point, they're unusable data oftentimes, and then the data itself is not updated, so that there's different levels of quality data within hospitals. And so it's very important that health systems look at provider data management as a chance to make provider data a strategic asset for the organization, and then to elevate it so it can enable lots of different services for consumers. The last point on this, on the ticketing systems, that historically that non-FINE, non-provider data management clients use ticketing systems to update provider data. So phone number, fax number change, new retail address, things like that. And what that's created is really kind of a disjointed updating process, and that those end up being updated in the EMR, but they may not trickle down into the credentialing system. They may not go into the marketing database. And so part of the problem is that there is no easy tool set. There has not been an easy tool set to update provider data as well. So going to the next slide. But the reason that it's so hard to keep the data updated is that there's so many changes. And we have clients who are making in FIND 1,400 data changes a day within their FIND system. And that the reality is that every department in a hospital is keeping their own data and updating their own data. So whether it's the managed care group that's doing health plans, it could be the value-based care team that's managing the ACO participation. It could be the EMR team that's managing who's in the telehealth virtual care programs. Lots of different pieces: registration, scheduling, managing the intake of patients, and if their provider is not is a new referring provider and not in the EMR, how do they get that data into the EMR, for example? So there's a lot of different departments, typically 20 to 30 different departments, managing provider data in a siloed, independent fashion. And it's hard for organizations to get all that data into one place and have the same level of quality across it. Second problem is that healthcare is changing, right? I mean, COVID has been a huge example of how we have all shifted from a healthcare perspective into new product offerings and into new locations, into virtual visits. There's a huge expansion going on in value-based care ACOs. And plans are shifting as well and changing. So it's just hard to keep up. There's a lot of data changes, and then your organizations, what they're really looking at is what's the next growth vehicle for the health system, for the payer over the next 3 to 5 years, and how do we have a platform that enables that can serve up provider data in an enabling fashion across your different products. So what Find is, so we call it Find 360. It's a provider data management platform. So it's only focused on providers, people, places, and services. And it's a single hub. So it's one place where everyone goes to update data. And that data is then integrated back into all the core IT systems within both health systems and payers. And the simplicity of it is that we only allow one profile per provider. So if you go to your EMR, they typically have multiple redundant profiles on the same provider. And that's because registration scheduling is, building the provider profiles on the fly, and they end up with multiple different profiles. Tom White, for example, Thomas White could be two profiles in the same person. And so with Find, it enables only one profile per provider through our unique data mapping process. And that what we create through this notion of a single hub is uniform, very high quality data across all clinical, marketing, and claims systems. So the idea is that it's one system being updated by 50, 100. One of our largest kind of user base at one client site, this is a big health system up in Michigan, has 12,000 users who update data every day in the Find system. And then once it's updated, it updates all the different pieces, all the different IT systems, all the different departments. So whether it's managed care, value-based care, it could be marketing, it's definitely the EMR, places like that. Those are all being updated. And what this allows for is this single view, single hub, single profile, allows you to accelerate your move into digital healthcare as an enabling technology. Oh, sorry. So with Find, we focus on really organizing all the data from a provider data management process into this one single system that makes it a strategic asset for all of our clients, and to use that data in new ways as an enabling tool. It empowers search, and search can live on your website, it can live in your mobile app, it can live in your chatbots, it can live internally on every desktop as well. And then from the search perspective, once you find the right provider based on the rich data that's updated live through the PDM, provider data management platform, you then can book it. So the whole notion that you're closing the loop with scheduling the visit, and we integrate directly with the scheduling systems within most EMR vendors, so Epic and Cerner and other ones, and that what we enable is the right search for the right provider, and then hand that off into the booking environment directly. The platform itself is really designed for your organization. So it's designed for health systems, healthcare organizations to curate and manage all providers first. So it's an end user web tool that allows 1,000 different users at an organization to update provider data, for example. It allows you to enroll new providers. And so the point is that that enrollment should be a structured process into one system, provider data management system, that then directly integrates into Epic and Cerner and other EMR systems, but also downstream as well. And then we integrate with credentialing vendors as well. So any new credential providers we're bringing in to Find Realtime, and then we're enrolling the referring providers. Our typical clients have about 80,000 providers in their Find system. So that could be a couple thousand credentialed providers, and then 75 to 78,000 referring providers with lots and lots of users. And then we're pushing the data. Once that data is managed, curated, and the providers are enrolled, we're pushing that information directly into systems like Epic and Cerner. We're pushing those out to the consumer platforms of a health system, or healthcare organization, and we're keeping that data up to date, which I think is a critical question. through the curation by all the departments, updating Find updating all the core IT systems, and then also this notion that there's outreach to all the providers, and it can be to their delegates as well, who are updating their data, they're updating their participation in managed care, health plans, and value-based care providers, things like that. So the outreach tool enables the direct update by the providers into the Find system, as well as the front lines of the organization. That's scheduling, that's registration, it's all the ancillaries like radiology in the lab, who are dealing with thousands of encounters a day with providers. They're finding new good information on providers and updating that information in real time. And the reason that we're focused in on this area is that it's just a high cost burden for our clients. And so there's two sides of it. One is the front office, which is this consumerism piece that we've talked a little bit about, and we're going to talk more about that in a follow-on webinar as well. But really helping clients understand that through better consumer tools, search scheduling, and placing those into mobile apps, into chat, into websites, that it can increase revenue and help them not lose consumers who are searching for real-time healthcare services. And then on the back office side, which is really kind of what we're focused in on today with the provider data management piece for this conversation, is reducing the time it takes to enroll providers, updating providers. Again, it's mostly a ticketing system that still goes into silos, and then integrating all this with health plans and value-based care networks, so that it's one view of a provider, not a disjointed view. And then from a rev cycle perspective, a significant amount of dollars is delayed as far as claims are delayed, because the information in the claims on the referring physicians is incorrect. And if you go back to the slide where I was walking through the Find system, we have all the referring physicians in the system for you. So all that data is being updated, managed, curated, so that when you go to bill a claim, you have the credentialed doctor, but you also have the referring doctor's data, and you get paid much faster. You can see that's, it's millions of dollars of cost. Let me just move this out of the way. And so, where we start from a back office key operations perspective is we focus in on optimizing the EHR. So that's Epic, that's Cerner, it's the other EHR vendors, and really driving quality provider data into those systems that can be used from a clinical perspective. So how do you enroll new providers? How do you update the data? How do you coordinate? How do you get better care coordination data? Things like direct addresses, which are used for electronic discharge summaries. How do you get all that data? So we help our clients optimize those demographics, that provider data directly in the EHR. Then we work with our clients on the affiliations. And so how do you have the best rosters information for your plans and for your value-based care networks, and then integrating those tools from Find, we enable those into the search. So it's great provider data within the EHR, it's better network data in Find, and then that profile gets stronger and stronger as we update that information. And the last one is this rev cycle piece, where again, it's just interesting that because there's really no tool set to manage provider data within healthcare systems that's focused in on this enabling data, that the checks and balances on provider data at large from a referring perspective, again, this is not credentialed, doesn't exist. So there's lots and lots of holes in the rev cycle address that we help fix. We do that in the EHR. We do that also directly in claims systems itself. Some examples of EHR optimization. One of our clients, Kettering Health Network in Ohio, they were able to go, and because they were using a ticketing system before, they were able to go, once they use Find and they push Find out to the departments to curate the data real time, They were able to go from 15 different users down to one, as far as the folks that were managing the EHR, the provider profile, which is they use Epic. At UNC, so that's University of North Carolina, they were able to reduce bad data in their Epic SER by 75% by using Find, and that's improving every day from a process and technology perspective. In that Cabell Huntington, which is there in West Virginia, they were able to really lower the time it takes to update provider data. Again, what happens without systems, without provider data management systems, is a manual ticketing process that takes a developer away or an analyst away from the EHR issues and has them updating phone, fax, things like that. Why not push that out to the departments that are actually updating the data, that have the live update, and let them do it directly in the system? On the plan side, we have, this is listed 3 different clients: UNC, Orlando Health, and then one is a top 15 health system. And what they've been able to do is they've been able to better manage participation in their health networks, and so lowering their address errors, for example. So when they would mail off their certifications for participation in the network, they were able to lower it by 97%. It's amazing how much they've been able to address the error issue on provider data. Orlando manages a narrow network for the largest single site employer in the world, which is Disney World, and they use Find to manage the roster of providers, and then they embed that through search. That provider data, using our provider data management platform, they enable search within the employee portal for Disney that links directly into this updated, fresh, real-time data that's in the roster. And then one client went after one of the larger employers in their area to win a narrow network, so similar to what Orlando has done, and they were able to sell the narrow network employer by showing off the Find provider search tool. Again, that's the enabling piece, but the provider data management platform behind it is the one that actually manages all this rich, up-to-date data. And then rev cycle wise, University of Michigan Medicine now has been renamed. They have over 10,000 users of Find every day updating. They're the ones who do 1,400 updates every day within Find provider data. They have 80 plus thousand providers in their system. UNC was able to, from a rev cycle perspective, really lower the amount of failed faxes from a claims perspective. And then Kettering Health, and again in Ohio, is able to uses Find to manage sanctioned providers, and is able to lower the encounters they actually had with sanctioned providers by using Find's enabling provider data management platform to alert them not to work with certain providers who they thought were not sanctioned but were actually sanctioned. And so through all these different, through EHR optimization, network utilization and management, and through improving the rev cycle, we're able to save clients millions of dollars through better data, and it's all focused in on this single profile, single hub system. That's a provider data management platform. We really look at that. We're excited about the future. We think that digital health is just starting, and that our clients, health systems, health organizations, need to understand who their providers are. So really, it's about what they do, where they work, what their expertise is, what locations they service, what networks they're in. That data is rich data and needs to be managed real time. And that consumers are looking for accurate data. They do not want to book an appointment with somebody to realize later on that they don't take their insurance, for example. And so they need accurate real-time data. And then health systems, there's just a lot of change. I mean, that we're seeing over 1,000 different data changes daily within our client base. And that's because providers change phone numbers, fax numbers, they move, they add new addresses. And referring providers in particular, if you have 80,000 referring providers, that's a lot of data to manage times 600 fields. That's a tremendous amount of information to keep up to date. So you really need this single hub that focuses in on providers only, so people, places, and services, to enable better consumer engagement and really drive the businesses that you're only conceptually looking at right now. So what's going to happen in 3, 5, 10 years from now? We're all grappling with COVID, and I walked through those examples, but it's really important to understand that provider data management platforms can help you with things like COVID, but also for future growth areas that are just on the drawing boards right now. I believe that is my last slide. So with that, we'll open it up to questions.
Thank you, Tom. As he mentioned, we'd like to open it up to the audience now for questions. Use the questions section in the GoToWebinar panel to submit them. The first question I have, we would love to have a system like Find, but our Epic team feels that Epic is good enough. Are they wrong? How does Find coexist with Epic?
Yeah, so I mean, it's a great question. So we are a deep partner with Epic. If you go to the Epic App Orchard and search on Find, you'll find 2 different App Orchard applications that we've built with Epic. And so, and Epic treats us as their enrollment tool for provider data. So I'd love to find out who your TS is within Epic and talk to them. But yeah, we just, if you go to Epic's App Orchard and search on Find, you'll see that we are a deep partner with Epic.
Okay, we've deployed MDM a ways back at our health system, but we have had no success trying to use it for provider data. What guidance or ammunition can you give us so we can go back to our CTO and explain that the MDM won't work as a centralized provider data system of truth?
Okay. So MDMs are master data management systems, and they're designed for all types of data. So whether it's a piece of equipment, whether it's a physical facility, or even a person, it's a data structure platform to enable lots of different types of data. It's not focused on providers, so it's not a people, places, services application. And there's not defined curation tools. So the reason that Find is used to enable provider search, scheduling, things like that, is because people are using it every day as an update mechanism to get better data. And so we'll integrate with MDM systems. We'll certainly pull data from an MDM system. We can push it into an MDM system, but they're just not up to date, and they're because of the curation issue. And they're really not designed to be enablers for search and scheduling. Good question.
Okay. How do Find clients keep provider data up to date? What methods do they use?
So we call it feeds and fingers. And so the feeds are real-time integrations with with Epic as an example, or Cerner, but also with the credentialing system. And then the human approach is that we roll out the Find user interface. It's a web application to all the different departments that are there. We call them the frontline teams that are talking to providers every day. So providers order radiology work, so MRI. They order blood or lab work. Every time they place an order, the lab, the radiology facility verifies their contact information and their information. And so when they do that, they oftentimes will find that the fax number is wrong, or that the phone number is wrong, or the address is wrong. And so they can update those real time and Find, just like Michigan does, where they have over 10,000 users of Find directly from the department. So the idea is you democratize updates across the health system so that you can harvest all the great updates.
Terrific. This question looks like it's for Adam and/or Ryan. What guidance might you give health systems to prepare for and maximize an enterprise data management system, either like an MDM or Find? And the second part is, what best practices might you suggest for data and IT teams to serve internal customers better?
Yeah, a couple thoughts here. Great question too, by the way. I think start socializing it internally. Start having conversations now. It's know that even though you may feel you're the only one talking about it, other providers, other payers are talking about it left and right in terms of whether it be an MDM solution or more of an enterprise data management solution. So start socializing it, start looking at use cases. The one thing that I can tell you that providers always ask us is, well, how do other people do it? How do, what are some of the success stories around it? What can you share with us? So I think to almost kind of counterpart both of those would be to start doing your research, start looking at companies like Find, start looking at their use cases, start looking at other solutions out there to understand how do they engage, why did they engage, how much work did it take, and then what is going to be dedicated on my end versus the vendors end that we use. Adam, I don't know if you have any other thoughts you might share there, but those are some good practices just to start getting moving in terms of MDM or even an enterprise data management type solution.
Maybe just add the concept that you really need all stakeholders involved. If it's a single department, a single role driving initiatives, we tend to see frustration after opportunities start on initiatives. And I'm talking more generally on things. I think that's key. I think focusing on outcomes and ensuring that you don't just go into an initiative saying, well, this is the latest thing people are talking about. And I'm sure our provider friends on the webinar are doing that. But not only go into it with clear outcomes in mind, but one thing we tell vendors to do is be very prescriptive and guide your customers. And we've enjoyed working with vendors like Find that have that ability to be very prescriptive. And so I would just say ask a lot of questions, get a lot of people involved, and make sure you're focused on not just capabilities, but specific outcomes.
Thanks, Adam and Ryan. This looks like it's for Tom. I see that Simpler acquired Find. Why did you decide to partner with them, and what's the impact on Find?
Yeah, it's a great question. So Simpler, if you don't know, is a large, the top 20 kind of healthcare IT company in the country, and they're in the governance, risk management, and compliance areas. So provider credentialing, vendor credentialing, contract management, so back office pieces, and that the strategic fit between Find and Simpler is that they know providers very, very well, and they have a deep history in the provider space. Now theirs has been primarily on the credentialing side, and so we think that marrying a platform like Find that has all providers in it with the vertical product that manages deeply the credential side is a really strong combination to offer. And we work with all credentialing vendors, but this gives us an ability to really do some innovative things with the Simpler credentialing platform. So it's really fascinating, actually. And also work within the payer space too. So not just the healthcare system side, but also the payer side. And then from a Find perspective, we're growing very fast, and part of the interest that we had in Simpler was that they want to fuel and fund our growth. And so we're going to remain independent. We're going to work on product integration strategies. But as a company, I still run the company, and I report into Simpler. But Find is going to look for ways to really innovate with credentialing data, but then also remain independent and focus in on providing great customer service for our clients.
Terrific. This one looks like all of you could probably weigh in on it. And the question is, where do you see the next evolution of digital health, digital front door, and what's next for hospitals and health systems?
Who wants that one?
Jump in on that? Boy, that's a great question. And digital front door is one of the sexy new terms out there, and we're trying to understand it ourselves. I was talking to a CIO last Friday, and this individual was describing their intentions to investigate what does digital front door mean for them. And it really was related closely to what we're talking about today. The culmination and aggregation of all these entry points for the patient. If we could simplify our healthcare journeys and have access to everything and anything that helps us, we would like to think patient experience improvement should improve. We'd like to think costs should be reduced, clinician satisfaction should go up. So my comment to that is we are at class are trying to learn more about that. We have interest and intentions to go interview some major health systems and just understand their perspective and how we should be measuring this and thinking through that. So that's the first thing. I would just add that this feeling of consumerism is alive and well. And one silver lining from the pandemic, if that's not a cruel way to say this, is simply that we've seen what's possible. There was a lot of agreement that things like telehealth would absolutely improve healthcare, but it was down the road. And then the pandemic came. It was the option for standard care. It was the only way to do things in many cases. And so now that we've all had that experience, most of us as patients, nearly every clinician in the world has now had an experience, definitely in the United States. We've seen what healthcare could be like and should be like. And so, the concept of let's make it easier, let's get the data we need, let's help patients make decisions and communicate better. It's really been a catalyst of where things are headed. So we've got organizations asking us, what does healthcare look like now, and how should it look? So, boy, lots of greenfield, lots of decisions, lots of information coming at the market. Ryan, anything you'd add?
You know what, Adam? I think you hit a lot of points. Thing I'd share on the analytics front, because you could, when we think about the digital front door, it you could go a lot of different directions. But from an analytics focus area, things are really, hey, how do we get more information, the right information in the hands of the right people? Is that on a computer? Is that on a mobile device? Is that on an iPad? Is that some sort of alert mechanism? So the idea of information is key. It all starts, again, with that data management and to really drive where the focus area is. One thing I'll share with you guys is that AI is in many cases a buzzword still, but we've actually validated a lot of use cases in AI, whether it be clinical, financial, operational use cases. And the interesting part is taking the massive amounts of data that they're gathering and creating it in making physicians and clinicians and nurses interact with that data has just been absolute key into the EMR workflows and by alerts with mobile. So I think it could go a lot of different ways, but I think on the analytics front, especially on AI in the data management aspect, they really come together to help drive a front-end adoption solution for a lot of these healthcare providers. So I think on the analytics side, that's probably where I'd see some of the movement. Tom, love to hear your thoughts.
Yeah, I mean, I think of it as that transparency is going to be more and more the thing that healthcare systems strive for. That provider data is oftentimes hard to find inside an organization, and then let alone from a consumer perspective. consumers really are attracted to transparent things. So again, the Amazon example, I can search on a product, I can find it, I can see how much it's going to cost, I know when it's going to be delivered, all those types of things, and they already have my credit card information. I think consumers are going to look, and organizations are going to look for healthcare systems to be more transparent with their provider data. And so you have to know what the data is to be able to do that. So I really do think that what's available now in provider search and then what's going to be available in the future is going to be different as far as the data elements. There's going to be more cost information. There's going to be more, there are pre-auth work within the health plans, for example. I think we're going to enable consumers to really have a less friction, lower friction engagement with healthcare. Right now, it's hard. I mean, you drive up to a big hospital campus, they've got 15 buildings. You got to figure out which one to go to. You go in, you ask the information, person, the front desk, where do I go? And then you get on the elevator and you go to your appointment. And consumers just want transparency. They want to know how to get to something, when to go, and whether that's a mobile app, that has the appointment on it, that's tied into what they use every day, that directs them right to the office. It's already prepaid for, it's already pre-authorized, all those things. I think that digital, it means making it easier for the consumer to transact with healthcare. And that goes back to this whole product notion that healthcare needs to think of themselves as products, people, places, and services.
Thank you all for those answers. That was our last question. So with that, we'll conclude the webinar. Thank you to everyone who joined us today. And thank you, Tom, Adam, and Ryan, for the informative and interesting presentation. Sounds like there's some exciting things to look forward to. We look forward to seeing you at our next HIS Talk webinar. Enjoy the rest of your day.